it's not only about the mother, but both parents need to be counseled. Healthy lifestyle, exercise, all these things will help to reduce the stress. So today, myself and Dr. Vamsi, who is a neonatologist, will be discussing about how do we deal with mental health of parents where the babies are admitted in NICU. Dr. Vamsi, what are the common reasons why we see babies, generally babies born are with parents, but when they go to NICU, what are the common conditions where NICU admission is needed?
So majority of the babies who are get admitted NSU are born premature. So these babies need to be taken care specially for their temperature, respiratory, cardiac and nutrition. So we usually admit these babies to the NSU. Apart from this, certain term babies like who are having some respiratory difficulties, or the babies who have certain complications during the time of delivery, or any other congenital anomalies or malformation babies also need to be admitted to the NSU.
So, prematurity is the commonest reason for NICU admission, and it is very important for us to counsel these parents, because many a times, up to more than 70 to 80% of the times, prematurity, although there are reasons in about 20-30%, 70%, we do not know the reason for prematurity. So, it is very unexpected, because they expect the baby to be with the parents as soon as the baby is born. So, suddenly they are deprived of that, the baby is taken to NICU.
Yes.
So parents are very overwhelmed in terms of their mental health. It is very important for us to counsel them.
So I have a doubt. So when this kind of unexpected thing are happening and there will be so much an emotional shock, so how do you deal with these parents? How do you manage them? How do you counsel them?
Yeah, like I said, when it is unexpected, they'll have a lot of questions first thing. First thing is like they will ask what the reason is for prematurity, and how the baby's condition is when the baby is in NICU. So we should patiently answer them about each and every, patiently listen to them and answer each and every question. And also when it comes to the condition of the baby, we should have a discussion with you people in NICU, because it's always important to all of us to talk the same language. It's not that I say something and you say something to them. So we need to have a clear understanding about what is the course of action, that is what is the condition of the baby first of all, then what is the course of action that is going to be taken care of in NICU, and what would be the prognosis of the baby. So once we discuss with the neonatologist, we have to give them a clear treatment plan and how we are going to follow up. And it is also important that many a times in premature deliveries, we see that in resuscitating the baby, you quickly transfer the baby to NICU, so they hardly see the baby. So that is also very important. It will be useful sometimes to take them to NICU, show the baby. And the other thing is, when they see the NICU setting at the outset itself, they'll be very overwhelmed with lot of machines beeping around. So how to comfort them? What do you do when they come to NICU?
Yeah. So ideally, when the babies were transferring to the NS only, we try to show to the parents, other than maybe mother may not be in a state to see during the transport. We usually allow the father and the parents to see the baby so that they will have a quick look at the baby. So once the baby is transferred to the NSU, initially we have a counseling sessions with them before we allow them into the NSU. We discuss with the parents what are the conditions that the baby is going on, what are the equipments that baby is on. Suppose that baby is on ventilator, baby will have a monitoring probe and there will be a monitor. If the baby sees certain other equipment, we already explain them that these are all the equipment that baby is on. We prepare them before we allow into the NSU. When they go to the NSU, we ourselves along with our nursing staff will show the baby, tell them these all this equipment that is all these are being given for the baby in order to provide this kind of the support for the baby, and these are all the things that we need for the monitoring of the baby. And we explain them the sounds also will come because of certain reasons, and we briefly give this normative data for them so that they will have a clear idea and they may not take too much of stress about it.
Yeah, the other anxiety we see in this, especially the mother, is the infant bonding. Because they are the babies are separated immediately after birth, so they are very anxious about the separation anxiety they have. So, do you in our NICU in Rainbow, do you have anything to to calm them down?
Yeah. As you said, there is mother, especially the mother, will have so much of high anxiety because the baby is not with them. They don't know. They'll be worried that who will take care of my baby in the NICUs because they are not frequently coming to the babies. So what we tell is we just give the brief idea that we have these kind of sisters who manage the babies, and they will be continuously monitoring with the sisters and the doctors. And then we try to allow the mother as early as possible once she is stabilized to enter the NICU, go to the baby, touch the baby if possible. If it is very baby is a bit more stabilized, we even allow her to lift the baby. We also allow the mother to do the kangaroo mother care as soon as the baby is stabilized. And the third thing is in Rainbow, we have a family centered care facilities where we can keep the baby and mother together in the NSU.
Yeah.
So they'll be more bonded from there itself.
That's excellent, having a family-friendly NICU, because most of the times, once they see the baby, their mental status is much better. So when we talk about the mental status, it's not only about the mother, but both parents need to be counseled.
Yes.
And in all these, counseling, the communication is the key.
Yes.
So we have to update them about the progress of the baby, and at the same time it is important for, as an obstetrician, we need to assess the mental status of the parents, because sometimes we may not realize what they are going through. So like any other grief, they go through stages of initial denial phase, and then they may be angry why this has happened, and then slowly but some people may go into see pregnancy and the postnatal period are the most vulnerable period, especially for mother, to undergo these changes. Even normal postnatal blues is the incidence is as high as about 70%. So especially because they are very vulnerable in that period, because they are new mothers, they don't know how to handle certain things, and it's very high, this postnatal depression. The studies have shown that especially when the babies are in NICU, it is as high as sometimes from somewhere between 30 to 50%.
No,
It is very high, yes. So it is, as obstetrician, it is very important from our side that we time to time assess them, and then we need to, in case they are, if they are not coping with the stress or with the anxiety, and with if they are going slipping into depression, it's important for us to refer them at the right time. And we have a good team of perinatal psychiatrists, so you don't have to directly, because if you say that go to a psychiatrist, they may not accept it initially. So sit with them. We do have some certain screening questions where we go through. So if any of these screening questions are pointing towards that they might go into anxiety or depression, then it will be useful to send them for initial counseling session.
Yes. Actually, compared to the neonatologist, the parents might be more attached to you.
Yes.
Sometimes, even though they just discuss the brief medical part with us, they're more emotionally attached to you. You better know their mental status than more than us.
Exactly. So that is the reason, even though the child is in ICU and they are seeing, it will be useful to review them time to time. And at Rainbow, we always do visit the NICU and talk to the parents, even though they are not admitted, because many a times patients are, mother is discharged, but the baby continues to NICU. But then it is important for us to review them, and it's not only about the physical health, but mental health also is very important. And like I said, we have it has to be a psychiatrist who is trained in perinatal, because it's not, general psychiatrists may not give that much importance to this. So so the initial part would be to counsel them, and then again review them. If you feel that she's coping well and better, then it is fine. But then if it is not, then the next step would be to start her on some medication in liaison with the psychiatrist.
Also, we see that they are more stressed because they may not give the breast milk to the babies right forward from the time of the deliveries. And we know that majority of the mothers might not develop production of the milk from the day one itself. They just have a small colostrum. But we often ask them a bit more amount. So they also usually get stressed. But the good thing that we have is we have a good team of lactation counselors where we train the mothers before the delivery itself what are the phases of the lactation, so that they will be prepared enough. Also, when the baby get delivered and they are admitted to NSU, we try to explain the mother all these things. We try to motivate her how to express her milk. then how to store that milk. Even after discharge, sometimes the mother get discharged before the baby get discharged. Then we also train them how to handle this kind of the milk in their home, how to store, how to bring, all these things will do. And luckily we have a milk bank with us, so where we can supplement the mother's milk along with the milk bank milk, so that the growth and the chances for the infection is much less.
Exactly. So this is also a very good point where, see, to sum up, I think to improve the mental status of the parents, communication, like I said, is very important. Then bonding, where we take them to an ICU. In fact, if the mother has undergone cesarean section, once her urinary catheter is out, and once it is safe for her, we always allow them as early as possible to an ICU. So that will improve the bonding and helping them in terms of breast milk expression. So if the baby can be fed, we can directly feed the baby, or expressing, so that mother will not have complications. And among all these things, the most important thing is that we should include both not only the parents, mother and father, the immediate family members also should be involved in all this discussion. Because many a times also we see that once they go back home, somebody at home will start saying that, oh, this should not have happened. So it'll be useful to involve all of them, so that they also will not pressurize because especially in mental health, it is very, very important to involve the entire family.
Yeah. Also the family, we also try to train the family along with the mother, so that along with the mother they also can take the responsibility of managing the baby. So the mother will get an ample amount of rest and she can have a good mental health.
Yeah.
And I have one more doubt. So, do you often listen to the parents that what was the cause of this premature delivery? Is it my mistake that I have done something wrong, or that my nutrition is abnormal? So, what is the cause for this premature delivery? So, these questions are often heard by us. Will you also hear the same kind of questions?
Yeah, first thing they'll ask is why this has happened so early. So like I said earlier, the most of the times, in 70% of the times, we do not know the reason for premature delivery. In about 30%, say in these days, because of fertility treatments, we see a lot of multiple pregnancies where there is a risk of premature delivery. Or they can be, infections, urinary tract infections, which can, or, some medical conditions in the mother which can lead to premature delivery. But many a times we do not know the reason also for us. So when we explain them that, these are the things and these are all ruled out, then, and also we reassure them saying that it is nothing, that it is from your side that you have done something, that this has happened.
Also, if we, as we do routinely, any mother who are the risk for the preterm delivery, we usually have an antenatal counseling both with the neonatologist and the obstetrician, so that they'll be prepared for these kind of premature deliveries and the chances for the NSO admissions.
Yeah. So I think, the team, as a team, we should counsel them in terms of like delivery and what best we have done at the time of delivery, and how the baby is taken care of, and how the parents are taken care of. So that it itself will most of the times will be helpful.
Apart from our conversation, I would like to ask few questions frequently searched in the online by the pregnant mothers.
Sure.
So why do I feel anxious even though this is a happy time?
Even though pregnancy is a happy time, anxiety is very common, especially in the first time mothers, because it is a very new phase of life for the women, where she'll start hearing a lot of myths from everyone, saying that you should do this, you should, a lot of advice from people at home or friends, and she doesn't know whether what is right and what is wrong. So that is one of the commonest reason, and also anxiety, like how the pregnancy is going to be and how the child is going to be. So these are some of the reasons why women are anxious in pregnancy, what to eat, whether they are eating right or not, whether what they are eating will help the baby grow well or not. So a lot of questions they have. So these are the main common reasons for anxiety.
There are so many myths also,
Yes.
so they get confused. So the next question is it normal to have a mood swings every day?
It is normal to have mood swings, but then if you're coping well with the mood swings and it is not affecting your daily routine, it is okay. But if it is happening most of the days, every single day it is happening and it is affecting your daily routine, then definitely you need help.
Okay. How do I mentally prepare for the labor?
Mentally prepare for the labor. One is your regular visits to the obstetrician, and you talk to her about all your doubts and all your queries during pregnancy. And also, one of the things we have in Rainbow, which we found, which is very useful, is childbirth preparation classes. I would suggest everyone should attend these classes where we have in each trimester we talk about what are the common problems that you face because of lot of physical changes that the women goes. They'll have lot of most of the things will be normal. So these childbirth preparation classes will really help not only in during pregnancy, they also will prepare you for labor.
Is the stress that we are taking is harmful for my babies?
It's definitely, stress is always harmful for the baby. Although we do not have any blood tests or anything to show a direct correlation, but indirectly stress always affects. And in fact, the studies have shown that too much of stress in pregnancy can lead to growth restriction, like affect the birth weight of the baby. And these women are also prone for premature deliveries. So it is always, that is one of the reasons we encourage women to do the yoga, meditation, healthy lifestyle, exercise. All these things will help to reduce the stress.
So don't take stress. Put your stress on
Yes.
your obstetrician.
Yes.
So we often see the mental stress in the only mothers, but we often neglect the fathers. So fathers also have this kind of stress and mental issues when their baby is getting admitted to the NSUs. Not only that, they are missing their own cane. Also, they need to tackle the family, support the mother, and also the financial and everything needs to be taken by the father. So we often neglect the father. So we need to take care of the fathers, explain them, motivate them, give the positive things, also involve them in taking care of their baby. And we have found that Kangaroo Father Care KFC has found that there is so much of decrease in the stress in the fathers. So along with Kangaroo Mother Care, when mothers are not available, even the fathers can do the Kangaroo Father Care. It promotes both the baby's growth and also decreases stress levels in the father.
Yeah, that's a good point, because always many a times we see that fathers' mental health is neglected, but I think we should, like I said, we should involve both of them in every counseling session.
Yes, ma'am.
When a baby is born premature and the baby is shifted to an ICU, it definitely affects the mental health of the parents. So, as a team, from the obstetrician, the neonatologist, and if needed, a perinatal psychologist and a psychiatrist, if we all together handle this situation in an effective way, it will help the parents to go through this situation in a smooth way.